Imagine one of those old black and white Depression-era photographs. A man and wife huddled together in a strange place with their scrawny kids, standing there on a dirt road. Welcome to Main Street, Hornpain, Ontario, a little railway town north of Lake Superior. My dad, he worked hard on the railway, fixing trains and building our house. My mom, you could always find her hunched over a sewing machine or burning something on that wood stove. My brothers went to primary school to learn English, and they had large newspaper routes. It was already dark when the passenger train roared into the station. It was always late in wintertime. The old baggage handler grunted as he heaved those heavy newspaper bundles to the platform. We fell onto them like hungry dogs and rolled them onto the sleds and dragged them off to be delivered. Snow was crispy underfoot, but quickly froze. Ears, nose, fingers, and toes. When it was particularly cold, or the train was particularly late, my parents would come looking for us to ensure that their boys could make it home. When I think back at all the changes my family had to go through, I feel grateful. I feel grateful that we had the opportunity to change. Change was good. Now I want to give you an opportunity to change, to make a simple change that'll make your implant treatment more predictable and keep more of your patients smiling year after year. I've already experienced that for hundreds of my patients over the last 5 years. Why is it so difficult for dentists to control excess cement? Did you know that in a university study, prosthodontists restoring dental implants left behind residual subgingival cement 60% of the time? Did you know that? It's a well-known risk factor for peri-implant disease. Today, that could have easily been prevented with a simple change, choosing the reverse margin abutment. The profile of this abutment acts like a shield, preventing cement from going into the tissues and redirecting it to places that are easy to access and clean away. Let me tell you about my patient, Miracle. Miracle is a large man with hands as big as paddles. And he had a stroke on the right side, and he wanted to get a little bit of his life back in order. "Hey, Dr. Emil, can you fix my front teeth with those implants of yours?" Almost exactly 6 months after treatment was complete, he returned to the office, and I could tell he was rather disappointed. "Hey, Dr. Emil, there's something wrong with those implants of yours. They bleed when I brush them." "Well, Miracle, please have a seat and let me take a look." Sure enough, his gums were red and swollen. And I know subgingival cement can do that. But my assistant Anna and I are just so careful, and we take x-rays to confirm it's gone. "Well, Miracle, looks like we're going to have to do a little surgery and see what's under those gums of yours." Whoa! He didn't like that one bit. And on surgery day, just freezing him up was like baiting a hook with a squirmy worm. And there they were, 2 big flattened chunks of subgingival cement. I guess being careful was not enough. I cleaned them off, and in only 2 weeks at his post-operative appointment, he already came back to the office, and we knew we were both on the right track. Now, you may have some miracles in your practice, and millions of our patients worldwide are faced with preventable peri-implant disease every year, and they may wonder whether they made the right decisions about treatment. And countless dentist hours are wasted trying to manage this difficult and, yes, uncomfortable problem. Perhaps Benjamin Franklin was right. An ounce of prevention is still worth a pound of cure. The reverse margin abutment is that ounce of prevention. So the next time you make some decisions regarding the longevity of your patient's treatment or their long-term happiness, choose the reverse margin abutment. Go to reversemargin.com and make your life and your patient's life better today. Thank you.